On March 10, 2010, the Supreme Court upheld the constitutionality of the Affordable Health Care Act law. Thanks to this decision and the protections offered by the law, people across the nation who now have pre-existing conditions will be protected from discrimination based on their health status. Tonight, me, myself, LaTanya Johnson, DeAndrea Joyner, and Benson Curran will discuss the changes for children's pre-existing conditions and preventative care. As we look at this picture, there were a couple of constituents, lawmakers, aides, and a handful of others, including Victoria Reggie Kennedy, the widow of Senator Kennedy, M. Kennedy, who made a passing the legislation of his life's work. And I quote, "The bill I'm signing will set in motion reforms that generations of Americans have fought for and marched for and hungered to see," Mr. Obama said, adding, "Today we are affirming that essential truth, a truth with every nation and generation is called to rediscover itself, that we are not a nation that scales back its aspirations." Ms. Kennedy arrived wearing a blue bracelet that said "Ted Strong" on her wrist. Mr. Obama wore one too. The senator's son, Patrick J. Kennedy of Rhode Island, was also on hand carrying a gift for the president, a copy of his bill the father introduced in 1970 to provide national health insurance. On it, the younger Kennedy had written a personal message to Mr. Obama. Also in that picture, Mr. Obama was joined as well by a select group of just ordinary Americans. Among them was 11-year-old Marcellus Owens of Seattle, who became an advocate for health care reform for his mother died without insurance. Connie Anderson, whose sister is Natomia Canfield, the Ohio cancer patient who struggles to pay rising health premiums, because a case in point for Mr. Obama. The history of the healthcare reform. Healthcare reform has been discussed by every president since 1912. Some have discussed a single-payer system, and some have discussed modifying our current system. In 1934, President Ted Roosevelt and his Progressive Party endorsed Social Security and the unemployment insurance as their platform, but it failed to generate any traction. In November of 1945, President Harry S. Truman picked up the mantle for a 10-year plan to transform the existing national health care program just months after World War II. But that plan ultimately stalled in Congress as well. In a televised speech to nearly 20,000 people at New York's Madison Square Garden in May of 1962, President John F. Kennedy advocated legislation to provide health benefits to Social Security recipients. On July 31st, 1965, President Lyndon Johnson signed legislation creating the Medicare and Medicaid programs to provide comprehensive health care coverage for people aged 65 and older, as well as the poor, the blind, and the disabled. In 1961, we have President Richard Nixon back the proposal for recurring employers to provide a minimum level of health insurance for their workers while also maintaining competitive among private insurance companies. In July of 1988, Congress passed and President Reagan signed into law the Medicare Catastrophic Coverage Act, the most significant health care legislation since 1965. In 1993, President Bill Clinton launched the effort to provide universal health care coverage based on the idea of managed competition. In 1997, President Bill Clinton signed legislation to create the state's Children's Health Insurance Program, which is also known as CHIP, and a legislative initiative designed to provide federal matching funds. In December of 2003, President George Bush comes in now and signs the Medicaid Modernization Act, which expanded Medicaid to include prescription drug coverage. 2008, Hillary Rodham Clinton his backbone, she came in to promote a sweeping healthcare plan in her bid for the Democratic presidential nomination. She loses to Obama, who campaigns on a less comprehensive plan. But then in 2009, President Obama and the Democratic-controlled Congress spent an intense year ironing out legislation to mandate that everyone have coverage to pay a fine, or requires most companies to cover their workers, requires insurance companies to accept all comers regardless of any pre-existing conditions. In 2010, the American Medical Association and other big groups of health professionals led their way to effort to extend coverage to more than 30 million uninsured people.
How many Americans are actually uninsured? Figure 2 represents insurance trends for 1999 through 2010. Basically, it notes the insured Americans, the uninsured Americans, and the people who are insured. It tells who they're insured by. So, for an example, we're going to look at the uninsured. In 1999, the uninsured rate was at 13.6%. And if you notice, over in 2010, we've increased the amount of uninsured. So we're now at, as of 2010, the uninsured rate was at 16.3%. Who are the uninsured? So the first figure, figure 3, represents the profile of uninsured versus the total population by household income in 2010. So the total amount of uninsured in the U.S. is at 50 million. And each bracket represents the percentages for each. Figure 4 represents the profile of uninsured Americans versus the total population by age in 2010. So again, it represents the uninsured being at 50 million. Total population is 306 million. And each age that represents the amount that's uninsured. Children, pre-existing conditions. This rule applies whether or not a child's health problem or disability was discovered or treated before you apply for coverage. The new rule doesn't apply to grandfathered individual health plan insurance policies. Starting in 2014, these protections will be extended to Americans of all ages. Children can no longer be excluded or denied coverage due to a pre-existing condition. Children under the age of 19 will be covered as soon as the plan begins a plan year or policy year on or after September the 3rd, 2010. Preventative services coverage. Preventative services effective September the 3rd, 2010, coverage without paying any out-of-pocket co-insurances, co-pays, or deductibles. There are going to be additional 16 services covered for adults, 22 covered services for women, including pregnant women, and 27 covered preventative services for children. The types of coverages for children that's going to be extended within the Affordable Care Act are going to be services for alcohol and drug use, autism, sexually transmitted diseases, medical history for all children through their development, obesity screening, oral health, sexually transmitted diseases I mentioned already, vision screening, immunization, cervical dysplasia, and blood pressure, just to name a few. Some of the types of, some of the issues current issues that we have that will be covered under these, I just wanted to give you a note. The American Academy of Child and Adolescent Psychiatry noted that 1 in 5 Americans have lived with an alcoholic relative while growing up. In general, these children are at a greater risk of having emotional problems than children of those parents who are not alcoholics. Alcoholism runs in families, and children of alcoholics are 4 times more likely than other children to become alcoholics themselves. Compounding these psychological impacts of being raised by a parent who is suffering from alcohol abuse is the fact that most children of alcoholics have experienced some of the neglect of abuse. So this issue is something that services will be covered for these children. Childrenshealth.org, in an article titled "Overweight and Obese The percentage of overweight children in the United States is growing at an alarming rate. 1 out of every 3 kids are now considered overweight or obese. So this is one of the things that will be able to help the children that are dealing with these issues. Also, in HuffPost HealthyLiving.org noted that studies finds that 1 in every 4 teens in the United States has a sexually transmitted disease. At least some doctors say that the numbers might be a reflection of both oral only sex education and teens' own sense of vulnerability, because some sexually transmitted disease infections can cause infertility or cancer. The U.S. health officials called for a better screening and vaccinations and prevention. So this is one of the things that will help with this act. The types of coverages for adults, and I'm just going to name a few: hepatitis B, HPV, sexually transmitted diseases, influenza or the flu vaccination, type 2 diabetes screening for adults with high blood pressure, diet counseling for adults at a high risk for chronic disease, HIV screening for all adults at a high risk, immunization vaccines for adults, and hepatitis A.
So I'll be discussing some of the impacts of the CARE Act as well as the future implications of it. Some of the positive impacts include that there won't be any more out-of-pocket expenses like mammograms, colonoscopies, immunizations, and annual physical exams. There will be a 50% discount on brand name drugs and 7% discount on generic drugs, which is already in effect. It's going to help a lot more people who couldn't afford insurance before to now get insurance. Parents' children will be able to be covered under insurance for free, and they'll be able to give them checkups, well baby checkups, and well child checkups. Insurance companies will not be able to charge a higher premium for women over men. And some of the negative impacts would be that there's going to be an overall $950 billion deficit as a result of this. But another positive is that because of all the fees and taxes that are going to be included, it's going to be 143 billion reduction in the deficit over the long run. Another negative impact is that it's going to force the healthcare organizations to recalibrate their business model, and it's going to end up causing pay cuts, job losses, or businesses shutting down. So I wanted to compare this new act to the Walmart effect. So when Walmart comes into a new city and town, a lot of the mom and pop shops can't compete with them, so they have to get shut down because they can't meet the cost that Walmart has. So the government is much like Walmart in their negotiations with their suppliers. They require them to have a certain amount of costs and a certain amount of overhead, and if they can't meet those, they're going to go somewhere else or they're going to lose their business. So the government is basically going to all the healthcare organizations, forcing them to reduce their costs, and if they're unable to do that, they're going to have to eventually basically just get out of the business. Some of the pros of the new law are that it's going to expand the coverage. So 95% of residents will be able to gain access, and that roughly translates to about 32 million people who did not have coverage before will now have coverage. There's going to be a lot more competitive industry. Increased regulation will stop insurance companies from raising prices, and it'll create a more free-hand economy, kind of like our economy is now with the financial system. The market drives the prices. Insurance companies will have to accept everyone, so there won't be any more pre-existing condition exclusions. Prescriptions will be cheaper for seniors, which will close the gap in the donut hole coverage for Medicare and Medicaid. The average American will see a reduction in their insurance premiums. Some of the other pros I wanted to mention was that insurance companies will now be forced to post their balance sheets, executive compensation, and administrative costs online for the public to be able to see. So that's a big plus for them, for us rather. Some of the cons of the new law, and there are a lot. States have the options to opt out, which could leave 2 to 3 million people without coverage. So depending on what state you're going to end up being in, you may get coverage or you may not. and it's typically for the lower income family, this is going to affect the most. Employers are going to be fined up to $3,000 if they don't provide insurance plans. Also, just to mention, the pharmaceutical industry is going to be hit very heavily because their fines are going to be up to $84 billion for over the next 10 years for their drug production. Families with income of $250,000 and individual incomes with incomes up to $200,000 will have higher Medicare taxes, so they're going to bring home a smaller paycheck as well. And some large employer groups may have the cost involved passed on to their employees, which means the individual consumer, basically everybody in the public, will have a smaller paycheck because they're bringing those costs and fees to us, which may not actually help anybody in the end. And many providers will have a reduction in pay, as I mentioned. They're going to have to figure out and retool their organization and figure out a new business model to be able to counter-react to the new law. And some religious-based healthcare organizations are going to have a lot of issues with having to offer contraception. And a lot of Catholic hospitals, for example, have been strongly against this law, and it's been in the news a lot. So it's going to be a big issue with forcing them to do it, and it'll kind of be an issue of church and state again. Taxes for small businesses will be raised, requiring them to insure their full-time employees, which may cause them to go out of business if they're not able to afford it. And in 2014, Americans will be required to purchase insurance, and they'll have to pay a penalty, which is either $95 or 1% of their income. And this is going to eventually keep going up until 2015, and it'll gradually increase in the fees. And this will also create a shortage of healthcare resources. As of December 2012, there was only a third of the amount of healthcare organizations and physicians that are able to provide the current amount of people. So when you add 32 million to that number, it's going to cause an even bigger gap. And just a recap of the children's pre-existing conditions and preventative services. Children can no longer be excluded or denied coverage. Children under 19 will be covered as soon as the plan year begins. And children up to 25 will be able to stay with their parents' plans if they're unable to get their own insurance, or if they're unemployed, which has been a big issue right now. And there's going to be over 60 covered services with no additional out-of-pocket expenses. And some future issues just to think about is financial reform and healthcare reform are very similar issues to overcome. With the recent Dodd-Frank Act, there was a lot of controversy and issues because the financial industry is very strong and old, over a century old, just like healthcare is, and so they're very slow to change, especially healthcare. And this is going to cause a big problem in actually translating the law into actual effect and putting it into mandates. So it's going to require a lot of translation and interpretation, and this can be a big issue because with Dodd-Frank, they're still trying to figure out how to make it work within the actual industry itself. And also because of the political disparity of the act, all or parts of the law may be overturned if, say, next term, a Republican president comes in, they could easily just overturn the entire law. So there's no way for businesses to be able to try to counteract this or try to think of the future because they don't really know where it's going to end up going. And so we just want to know what your opinion is on the new laws, because everyone has their own opinion and it affects each of us differently. So it's a very big issue right now because government's never put a law this effective that it's going to affect everyone really. So I guess we'd like to know what your opinion is if you want to post those information, and thank you for your time.